So I talked a little bit about getting an epidural and what that looks like and how that is done, but let's talk about the benefits and risks of receiving an epidural anesthesia during labor and birth. I know some women can probably feel a little bit conflicted inside about whether they want to get one, whether they don't. And some people kind of do like a trial of error, like they want to see how far they can go without an epidural, things like that. So let's just talk about the benefits and risks. Benefits. It will numb you from the nipples to knees to feet. Like I said, sometimes that's to like the waist down. It just kind of depends. It's a little different for every woman. Some feel it more on one side than the other. So you don't feel anything, which means you have either no pain or less pain during contractions. Some women report to feel that they don't feel anything. Some women feel that they just feel the pressure. So like I said, it kind of depends on you, but it's not going to feel painful. We know that for sure. You will be more relaxed. You'll be less anxious. You'll be able to get some rest and some sleep. And not only are you going to be more relaxed and less anxious, I think your partner will match your mood. And so once you're relaxed and less, anxious, things like that, your partner will be able to do the same. And sometimes, they're able to be there for you more whenever things aren't so crazy and anxious in the delivery room. Some risks that could happen, labor will slow down whenever you have an epidural, no matter at what point you get it. And because your labor will slow down, that tends to mean that other interventions may become necessary. So receiving Pitocin, maybe some other interventions during the actual birth part may become necessary. You will most likely have a longer labor because your labor will slow down. Your blood pressure will become low, which could cause nausea, dizziness. Once again, this isn't for everybody. This does not mean this is going to happen to you for sure, but these are just risks that could happen. I personally, I received an epidural both times for my births, and I did not really get sick or nauseous at all during the epidural. It was more so before when I was having contractions. And then also it can sometimes cause a fever. So if you're struggling with, wanting to decide on an epidural or not an epidural, just think about those benefits and risks and think about what's most important to you. And I think that it's important that you discuss those with your partner as well before making the decision to get one, and just make sure that everybody's on the same page.